Morning, this is Dr. Biplab Taudia. In today's lecture, we will talk about road traffic accident and other injuries. Now, coming to the definition, it is defined as an unexpected, unplanned occurrence which may involve injury. Now, WHO Advisory Group in 1950 also had a definition of unpremeditated event resulting in recognizable damage. Now there is another definition which is occurrence in a sequence of event which usually produces unintended injury, death or property damage. Now coming to the measurement of the problem, so how will you measure the accidents and other injuries? Now coming to mortality, this is about proportional mortality rate. So what is proportional mortality rate? This is number of deaths due to accidents per 100 or 1000 total deaths. So if there are total deaths of 100 and 1000, how many of them are due to accident? Now what is number of deaths per million population? This is defined as any person who is killed or died within 30 days as a result of accident. Now what is death per 1000? Death per 1000 is death rate per 1000 registered vehicles. Number of accident or fatalities. So number of accident or fatalities is ratio of number of vehicles per kilometer or passengers per kilometer. In morbidity, there is serious injuries and slight injuries. We will also discuss about this, and there is abbreviated injury scale. Okay? And also there is disability. Disability is defined by ICF, that is International Classification of Functioning Disability and Health. Now coming to the problem, there are the problem in the world. It is mostly there are intentional injuries and unintentional injuries. We will discuss in detail what are the difference between this intentional and unintentional injuries. Then there are injuries affecting the smaller children. The smaller children, it will affect like poisoning, drowning, burns, maltreatment by caregivers. Now, the injuries which affect the older children, adolescent and adults includes road traffic accident, interpersonal violences and sports injury. So now coming to what is the interpersonal violences, like homicide, sexual assault, neglect and abandonment. So these are the interpersonal violences. You can see in the table, it is given about the unintentional injuries and intentional injuries. So you can see due to unintentional injury there are more deaths, which mostly include this road traffic injuries. Then there is falls, then there is drowning. Okay. So it contributes like road traffic injuries constitute around 2.5%. Falls constitute 1.2%, drowning constitute 0.6%. Unintentional injuries, it is mostly the self-harm, which constitute about 1.4%. Now, road traffic injuries and unintentional injuries are included in the health goal of Sustainable Development Goal 3. particularly this target number 3.6, which aims at reducing road injuries and deaths. Here you can see the selected SDG indicators when it compares to global and Indian scenario. You can see the average death rate due to natural disaster is similar in both the case, that is less point 0.1. It is lesser than 0.1. Now the mortality rate due to homicide is more in global scenario as compared to India. Also in direct deaths from major conflicts, it is more 2.5 and less than 1.1 in India. Also, unintentional poisoning, globally it is higher as compared to India. But you can see the suicide mortality rate. It is higher. The suicide mortality rate, it is higher in India as compared to the global scenario. Road traffic accident also is higher in global scenario as compared to India. Now, Indian scenario is that there is increase in mechanization in agriculture. Now, there are a lot of agriculture equipments like mechanized agriculture equipments, tractors, which are used in agriculture as well as industries. And there is induction of semi-skilled and unskilled worker. Many of them are not properly skilled, so they don't know how to operate these vehicles or these equipments. So this is one of the reason where there is increase in increase in agriculture as well as industrial accidents. And also there is increase in vehicular traffic. In the graph you can see now in the metro cities for a covering also 5 kilometer it takes almost half an hour and sometimes 1 hour. So there is increase in this traffic and there is increase in the number of vehicles in the road, due to which there is increase in vehicular traffic. And there is overcrowding, lack of awareness, poor implementation of essential safety precautions. Okay. Then there is consumption of poisonous substance accidentally or intentionally. In India, the organophosphate poisoning for suicidal purpose is also very high prevalence. Okay. Now, types of accidents, it includes road traffic accidents, domestic accidents, industrial accident, railway accident, and violence. For this lecture, we will mostly focus on this road traffic accidents. Now, road traffic accidents are the 8th leading cause of death for children and young adults who are 5 to 29 years old. Okay. Now, vulnerable users like pedestrian, cyclist, and motorcyclist. Pedestrians who are walk in the, you can see in the picture, who are walking in the roads or in the nearby roads. Cyclists are also at the risk, as well as motorcyclists. Now the risk of road traffic is more than 3 times. That means 3x in low income countries than in high income countries. So in low and middle income countries like India, it is the risk of road traffic accident is more as compared to high income countries like USA or UK. Males are also more likely to be involved than females. In India, the prevalence of road traffic accident is higher in Chennai. You can see Chennai. Then there is Delhi. Then there is Bangalore. ठीक है, चेन्नई में 9.1%, Delhi 8.1%, and Bangalore 5.8%. The road traffic deaths mostly occur due to dangerous and careless driving, overtaking, that is 29%. Dangerous driving, and overtaking, which constitute 29%. And under the influence of alcohol, it is 2%. Now, places of occurrence of death in road traffic accident. In India, it mostly occur in the residential area, that is 30.2%. And then comes the factories or industrial areas, then school, colleges, or other educational institutions. Now, risk factor includes speed, drink driving, motorcycle helmets, seatbelts, and child restraint. So it depends on this. If you are on high speed, if you are drink driving, if you are not wearing any motorcycle helmets, not wearing seat belts or child restraint, then there is a risk factor, risk for accident. Coming to speed, the pedestrian have 90% chance of surviving a crash if it is less than 30 km per hour. If there is a speed limit, then the chances of surviving a car crash is more among the pedestrian. And then there is 30 kilometer per hour speed juice reduces the risk of crash. And low traffic speeds have a positive impact on health outcome like reducing respiratory problems associated with car emission. Drink driving. The risk of being involved in a crash increases significantly above a blood alcohol concentration, that is BSE, of 0.04 gram per deciliter. Enforcing sobriety checkpoints and random breathing tests can lead to reduction in alcohol-related crash by 20%. So at 20%, if we have checkpoints for checking blood alcohol concentration, random breathing testings, so these can reduce the chances of crashes by 20%. Motorcycle helmets. Wearing helmets correctly can reduce the risk of death by 42% and reduce of severe head injury or traumatic head injury by 69%. Seat belt. Wearing a seat belt reduces the risk of fatality among front seat passengers by 40 to 50%. So the front seat passengers have reduction in chances of fatality by 40 to 50% if they are wearing a seat belt, and rear seat passengers they have 25 to 75% chances of reduction. And mandatory seatbelt laws also increase the seatbelt wearing rates. The child restraint reduced the death among infants by 70% and small children by 54 to 80%. Distracted driving. The distraction caused by mobile phones impair driving performance by longer reaction times, impaired ability to keep in correct lane, and shorter following distance. Nowadays, because of mobile phones, there is increase in incidence of accidents. The text messaging also results in reduced driving performance. So even text messaging is not safe. Drivers using a mobile phone use are 4 times more likely to be involved in a crash. So 4 times you are more likely to be involved in a crash if you are using a mobile phone. Now, what is the difference between developing and countries as well as industrial countries when it comes to road traffic accidents? So the scenario is that the large number of pedestrians and animals share the roadway with fast moving and slow moving vehicles like bullock carts and etc. In India, you can see there here in the photo also you see tractors are going, auto rickshaws are going, there is this two-wheelers are going, pedestrian are also there. So there is no segregation of pedestrian from vehicular traffic. So जो ट्रैफिक है और pedestrian का जो walking path है उसमें कोई separation नहीं है. So there is no separation. That's why it increases the chances of having a road traffic accident. And old poorly maintained vehicles भी use होते हैं जिनकी proper servicing नहीं हो रही होती है, ठीक है ना. So large number of motorcycles, scooters and mopeds are also used in India. There is low driving standards. There is number of buses are very large, often overloaded. There is widespread disregard for traffic rules. There is defective roads, poor street lighting, defective layout of crossroads and speed breakers, and there is unusual behavior of men and animals. So you can see the buses are also overloaded. The people don't follow the traffic rules. The roads are defective. It takes a lot of time to repair the road. So I think these are the main reason of difference between the road traffic road scenario of developing and industrial countries. The Southeast Asian region, particularly the semi-urban and rural area, constitutes 60 to 80% of the accidental injuries. So the more injuries are in the semi-urban or rural areas. While we mostly get the news about the urban areas, but you can see the prevalence is more in urban or rural areas. The RTA or road traffic injuries are considered economic loss for victims, their family, and the nation as a whole. So, yeah, economic loss. How is the economic loss is there? There is cost of treatment, including rehabilitation, incident investigation, and there is reduced or lost productivity. For example, in the form of wages, if you're working. So, if you had an accident, so if you are not able to perform your job, then you have reduced or lost productivity. Family members also need to take time to take care of the injured. So In this way, there is economic loss to the in this there is loss of in terms of productivity as well as economic loss if you are a victim of accident. Multiple causation, up to 90% of the factors are responsible for are attributed to human failure. So there are three factors like human factors, environmental factors, and precipitating factors. So almost 90% are due to this human factor. So we'll discuss in detail about these three factors. Now you can see what are the in this diagram from park. You can see the human factors. Human factor like age, okay. So at what age you are at the risk of this at what age you are at the risk of accidents, okay. Then there is sex. Male are more prone. Education, if you are not educated that much. Medical conditions like sudden illness, heart attack, impaired vision, fatigue. Psychosocial factors like lack of experience, risk-taking behavior, impulsiveness, defective judgment, if you are having delay in making decisions, aggressiveness, poor perception, family dysfunction, okay. Then there is lack of body protection like in the form of helmets in two-wheeler and safety belts in four-wheeler. Now coming to the environmental factors relating to road like defective or narrow roads, defective layout or crossroad and speed breakers, poor lighting, lack of familiarity. If you are driving or riding in a new road which you are not familiar, okay. If you are riding in the night and there is very few lights in the street lights in the road. Now relating the vehicle, there is excessive speed. If the vehicle is not poorly very old and poorly maintained, there are large number of two and three wheelers, overloaded buses, low driving standard. So for vehicle condition, if you are having excessive speed, if you are not doing the servicing of your vehicle properly, if the buses are overloaded, okay. Then there is bad weather like inadequate enforcement of existing law. So in bad weather also there is some guidelines from the municipal corporation, okay, like regarding how to whether to go or use a road or not. There is mixed traffic like slow or fast moving and pedestrian and animals. Okay. Then coming to this increased vulnerability and risk situation, both the human factor and environmental factor they increase the vulnerability and risk situation. Now coming to the precipitating factor, मतलब उस वक्त जब precipitate कर सकता है like heightened emotional tension. If you are very tense, you are worried about something, and if you are on alcohol, drugs, ठीक है ना? So these are the precipitating factors. Also, there are specific traffic conditions like social pressure, traveling in groups, so like peer pressure. So there, if you are an adolescent or young, you will have that we have to drive very speed to look cool or smart. ठीक है ना? Just like that. So use a stolen vehicle. The people who stole vehicle also drive at a very fast pace. So these all these things contribute to the accident. So you can see there are human factors. There are human factors which are 90% सबसे ज़्यादा इसको होता है. Then there is environmental factor and there are precipitating factors which you need to know. Now coming to the prevention, there is a quote that accident don't just happen, they are caused. ठीक है. तो the thing is that these are not like things it just happens, it are caused due to multiple factors, and there are always chances of reduction in accidents if we follow the proper guidelines. We will coming into what are the things we can do for the prevention of accidents. The first thing is that the data collection. So this is for at an administrative level or a government level that all the basic reporting system should be there for all the accidents. There should be national data supplemented by special surveys. They should be there. There should be in-depth studies. There should be data collection regarding road, vehicle, and weather. So it is a responsibility of government to have the data, and the transport department to have the data of the different roads, vehicles, and weathers. Now safety education. So education and awareness is very important thing. There should be training for drivers. So there should be training of drivers for proper maintenance, how to maintain vehicle and safe driving. Okay. Then there is the education of young people towards risk factors, traffic rules, and safety promotion. So the youth should be educated towards what are the risk factors, like when you are using mobile phone or you are taking uh, alcohol, and if you are not following traffic rules, then you are at a risk of having a road traffic accident. Promotion of safety measures like seat belt, safety helmets, children having restraints and others. We will come and discuss about these things also. Alcohol and other drugs. Alcohol is direct cause of 30 to 50% of severe road traffic accidents. Like drugs such as barbiturates, amphetamines, cannabis should be avoided totally. Okay? So drugs and alcohol should be avoided. Primary care. Planning, organization, and management of trauma treatment and emergency care should be there. The emergency care should begin at the accident site. Okay? There should be continued during the transportation and conclude in the hospital room. From the accident side, it should be during the transportation as well as ending at the hospital room. Now, developing skills of healthcare worker and increasing availability of needed emergency equipment. Also, there should be formation of accident service and organization development for fully equipped trauma care centers. Specialized trauma care centers should be there in every city for treatment of road accident cases. Elimination of positive factors like improvement of roads. The road should be, when the potholes or any kind of deformity in the road should be repaired. There should be imposition of speed limits, okay, and marking of danger points, like here you can see there is a mark, okay. Then there is enforcement of laws like driving test, medical fitness to drive, enforcement of speed limits, compulsory wearing of seat belts, and crash helmets. Now, the rehabilitation service include to prevent or reduce or compensate the disability and thereby reducing the handicap. And there should be accident research, gathering precise information, extent, and other characteristics of accident correlating to accident experience. There should be data collection regarding what are the characteristics of accident and personal attributes and environment which also occurs, and there is a special branch of accidentology is also coming. Okay. Thank you for watching this video. I hope it was useful to you. I will be also sharing the PPT of this video. You can download it from the link below, and please like, share and subscribe for more such kind of videos.